So I am going to present how to develop personal formula for disease. So as you know, physicians writing the drug for disease, that is his own choice. So that is his personal drug. Means they have developed own drugs, keeping in mind efficacy, safety, cost, convenience. But they are quantitative thinking, not they are qualitative thinking, not in quantity. They are not converted into quantity by. So here we can detail about how to develop personal drug, and its description is called personal formulary for disease. One of the goals of WHO is a rational use of medicine. Patients should receive medication appropriate to their specific clinical needs. Suppose that they have a dysentery, clinical features, as you know, there is a passing the stool with the mucus, blood. So we have to give the such drug which kills the trophozoites of amoebic dysentery, like the metronidazole. Proper dose and duration, how many dose, how many days, that is also important. With lowest cost to them and their community. Cost is also, we can use as such drug that cost is also less to them and their community. The WHO requirement will be fulfilled by WHO good guide to good prescribing that is available in net. This gives medical students normative model for therapeutic reasoning and prescribing, provides 6 steps to the process of rational prescribing. First, we can define the patient problem. Second, specify the therapeutic objective. Third, choose a drug for treatment. That is today is our main aim, drug for choosing the disease. Fourth is a right prescription and start the treatment, and give the patient information, warning, and monitor the patient. Monitor the treatment. So that is a personal formulary, means description of personal drug, whichever is chosen. So that is called as a personal formulary. As you know, National Formulary of India seems like that. We have developed one formulary, that is a personal formulary for particular drug, particular disease for particular drug. So here you can see patient problem. Brief describe about how to reach the diagnosis. History, sign and symptoms, laboratory test, ultimate endgame of diagnosis. So like that, amoebic dysentery, we have the passing the stool with mucus and blood, tenesmus pain, and all these things. Therapeutic objective is useful to define exactly what you want to achieve the drug for example, to cure an infectious disease or suppressing the feeling of anxiety. So here I am giving the 2 examples on the, so like various disease, by various disease you have the some therapeutic objective. Like here amoebic dysentery, we can give as such drug that kill the trophozoites, so they cannot form the ulcer. In case of amoebiasis with a specific therapeutic objective, would we treat the sign and symptoms, indicate the disease, and prevent the transmission of disease and further complication. The purpose of monitoring is check the whether the treatment has solved the patient problem or not. One of the key principles of WHO approach is the division of 3 steps. Step 3, choose a drug for treatment. That in 2 steps. One is a standard feed drug treatment for disease in general. Later on, we can verify the suitability of that drug is fit for that disease with comorbid condition. Like that, if you are giving the drug for amoebic dysentery, or person is alcoholic, they are not consuming daily alcohol, so that we are knowing amoebic dysentery, we have the drug of choice like the metronidazole. But here we cannot give the metronidazole for amoebic dysentery if person is alcoholic or taking the alcohol daily. So we can give here a standardizole that has not produces disulfiram-like reaction. There is a metronidazole produces disulfiram-like reaction. Verify the suitability of particular patient. So I told how can you verify. So you can change the drug from metronidazole to the disulfiram. The emphasis is that future doctors should master in both the steps: selection process in quantitative terms and verification of suitability, and alter the drug for individualize the treatment. So suitability, and we can alter the drug like that. Here, amyloid dysentery, we are commonly using metronidazole, and we can alter the drug with alcoholic like cetronidazole. Selecting the correct drug for disease is not easy task. We are selecting the drug for disease if you have the full knowledge of all the parameters like efficacy, safety, cost, and convenience. So how physicians select the drug for disease? They are keeping in mind and select the drug for disease, but they are not quantifying. Means they are not in quantitative wise. They are not selecting the drug. How much points will give this? How much points will give for this drug for different parameters like efficacy, safety, cost, and convenience. I am now telling out convenience, or many of times physician is influenced by medical representative. That is definitely a biased decision. So that is a ethical problem that we are not going to discuss in detail. So personal drug concept deal with the selection of drug for disease, a standard treatment for common disorder, and a set of first choice drug called personal or P drug, and its description is called personal formulary. So now, how to develop P drug? I told before, according to WHO Guide for Good Prescribing, parameters considered in development of P drugs are efficacy, safety, cost, and suitability that you can easily get in net. But especially, we followed the method in described by Joshi and Jai Vikram Raya. The 4 criteria here is efficacy, safety, cost, and convenience are considered while selecting the P drug. Here we are in a state of, initially we are not suitability, but later on we can verify with the suitability for particular patient. Next step is to verify the suitability for selected P drug for particular patient. I told before also like that, dysentery, maybe your drug, maybe your personal drug, maybe tinidazole or metronidazole, whatever. So person with alcoholic, you cannot give the metronidazole, tinidazole, so you can verify the suitability. So this drug we can give to this patient, that is again required verification. So that is verify the suitability for P drug for particular patient. So we can change that. Like that alcoholic patient for amyloid dysentery, we can give the cetronidazole. So what are the requirement of P drug? I told physician keeping in mind and previous knowledge they are selecting the drug for disease. But it is not a proper process, we can say. So we have the quantity process that we can discuss later on. The student and doctors carried out the exercise in their groups. So we can make the groups of 6 people or 4 people of different 3 and 4 groups. 4 and 5, 3 as minimum 4 and minimum 4 groups. Like that. The use of textbook 4 group or 3 group. That is not so matter. But use of textbook and reference material available in the college and departmental library for other criteria. So even sometimes textbook is not giving the source detail. So we can go for reference materials like Goodman Gilliman, Martindale, and available in the college and departmental library for other criteria. Suppose that we are choosing the P drug for amoebasis. Each of the 4 criteria given the score between 0 to 4, efficacy, safety, cost, and convenience. So we are giving the more important to efficacy because you have to treat the disease. So here 0 to 1 divided like that, 0.4 for efficacy. Important parameter given for efficacy are more important parameter given a score 0.4, safety 0.3, cost 0.2, and convenience 0.1 respectively. Then determine the drug and drug group by using the standard textbook. So here we can sometimes drug only for disease like the otitis media. We have not such a big class. So we can even class we can want 2 drugs. So we can directly go to consider all the 4 parameters. Here you can see what a drug group of used in treatment of emesis, like nitroimidazole, alkaloids, protein, amides, hydroxyquinolines, antibiotics. These are different drug groups used in the treatment of emesis. So we told before we can divide the one into in terms of efficacy 0.4, safety 0.3, cost 0.2, convenience 0.1. And here we can again give the points among 10. So like the nitrometazole, that is a good efficacy, we given 9 points among 10. And again, alkaloids is a good efficacy, we given 9 points. Another have less efficacy. So according to that, we can give the points after with the good discussion among the groups. So here you can, then we can multiply alpha and beta together, like 9 is 0.4, 3.6, 7 into 0.3, 2.5. As you know, the nitroimidazole have, many of the nitroimidazole causes metallic test and all these. So we have given the safety profile comparatively not good. Alkaloids are also so toxic, so we can given the less point for alkaloids. So we can read thoroughly what the individual drugs and we can give the points accordingly. And cost also we can hear what are the treatment cost for particular disease. So many brands, so we can take average cost. So we can see later on how they make the cost, table. So convenience, as you know, we can give the convenience like many of the nitroimidazole given once also. So we can accordingly that we can give the points. So here you can see nitroimidazole is coming as a max highest 7.5. That is article is published in by me and my colleagues. Student perception regarding personal drug selection and sign IJPCS. So that you can go and read, so you can get all the details. So next step is among nitroimidazole, we can choose the drug for emesis. So now we can choose among drug, not a group. So drug is like metronidazole, tindazole, secnidazole, or nidazole, cetronidazole. So we are given almost all are same efficacy, so given 9 points. Metronidazole, as you know, that is causes more metallic test, so given 6 points. So like that we are given the points. And ultimately here come to about 10 we are giving the points, and same efficacy 0.4, safety 0.3, cost 0.2, convenience 0.1. So again alpha and beta multiply, and then we can horizontally calculate them as a total. So highest for tindazole, that is a 8 point. So personal drug for emesis is a tindazole, not metronidazole. Many of the book written even metronidazole is a drug of choice, but tindazole is efficacy is similar, convenience is more better because it's taken once also, twice, but metronidazole taken thrice. Whereas metronidazole has the highest metallic test. So all the view here and discussing among them, among the different group, we can got P drug is a tindazole. So particular disease each for criteria was given a score between 0 and 1, say alpha. And for each drug, and drug score was given between 1 to 10, is say beta. Multiply and alpha and beta get new value, that is a gamma. From then for each drug, add all gamma and values get total score. So select drug and drug group with highest score. That is a P drug. Whenever there is a large choice of agent is available from same class, thus choosing the particular drug from class for therapy is very important. Selected drug is a P drug. So here we can again, after selection of drug for disease, we can verify the suitability for particular patient. So 50-year-old female living in Sasaram complains of bloody mucoid stool, tenesmus pain in abdomen, presence of trophozoite of antimeba histolica in stool. There is no history of alcohol abuse. You have diagnosed a case of acute amoebic dysentery. But this patient, we can give tindazole or not. Definitely we can give the tindazole to this patient because there is no history of alcohol abuse. So there is no chance of disulfide reaction. As we know, many of the nitroimidazole causes disulfide reaction. There is one exception, like cetronidazole, that is not causes disulfide-like reaction. If patient with history of alcohol abuse, I written no, history of alcohol abuse, then we can give the here instead of tinidazole, we can give cetronidazole. So there is no history of alcohol abuse. So here the same P drug you can use this patient. After selecting of the personal drug component, formulary is developed. Formulary is nothing. It is a description of the drug. So you can take from the National Formulary of India or local, many of them like the SIMS, MIMS, NIMS. So or make from the textbook even, containing details about the effects of the drug, side effect, instruction, burning, and next point. That details written in leaflet notebook. That is a personal formulary. Personal drug description is personal formulary. So here you can again see how to develop personal formulary for anxiety disorder. We are knowing drug group used for anxiety disorder is benzodiazepine, azathioprine, sedative antihistaminic, beta blocker, SSRI. So benzodiazepine almost effective in various type of anxiety. So efficacy is more. And after giving all these things, seeing the different parameter, we give in the different points. Ultimately, highest point we got in regarding benzodiazepine. And among the benzodiazepine, various drugs is used like alprazolam, diazepam, lorazepam, oxazepam. So again, we are giving the different points for divided for 10 for like alprazolam, we given 8. So here is a total point for alprazolam is 7.3. Safety profile of diazepam is not so good. Comparatively, there is more chance of daytime sleepiness also. So we are given less. So here we can get the P drug is alprazolam for the anxiety disorder. But according to situation, you can change. Some person is going for an interview tomorrow. So, okay. So that condition, definitely we can give alprazolam. That condition, even we are not giving it diazepam. So that is again, alprazolam in this type of situation is effective. Or many of the situation, it can be changed also. So here you can see how to develop the cost of treatment for particular disease. Even CMDT is a given cost of treatment. CMDT means current medical diagnosis treatment, that are given given various disease cost of treatment. But that can be not suit for India, because India have the different cost for different drugs compared to in dollars and others. So we have the many of the SIMS, NIMS, drug Indian whatever. So SIMS, MIMS, and Indian drugs whatever. So diazepam, chlorodiazepoxide, oxazepam, lorazepam, alprazolam. So we are given the dose range. So we can choose the lowest dose cost in the range. We can make the average of them for around 1 month, because this is anxiety disorder treatment is longer. And according to this cost, we can give the points there. So description, anxiety disorder, here you have got the alprazolam. So we can write the all description of alprazolam, that is called a personal formulary. Description of alprazolam is a personal formulary. So above we are given the strength 0.5, 0.5, 1 mg anxiolytic alprazolam, and below given all the details. Okay, here are all the details. So we have the National Formulary of India. So from that we can make own personal formulary after choosing the P drug. So that is a personal formulary. So National Formulary, all the drugs are mentioned, but we can choose them for as a disease, for a particular disease, that is a personal P drug, and description of that drug is called personal formulary, that may be derived from National Formulary of India. So what is the take-home message? P drug is not always drug of choice. Here you already saw in amoebic dysentery is a P drug is tinazole, but many of the textbook is written drug of choice is metronidazole. We have to develop own personal formulary by quantity, not keeping in only mind. So there is a more comparatively more important, or little bit is debatable. By the process, we will able to achieve one of the goal of WHO is the rational use of medicine. Thank you.